There we go.
Thank you so much for having me. It is truly an honor to be here. My name is Robin Bone, as you know, and I'm a board certified OBGYN. I'm also a menopause certified practitioner, and I've been in practice for 26 years here in Metairie since my entire career, taking care of women throughout the years. So as I've gotten older, now that I'm 55, as I've gotten older, my patients have gotten older, and menopause and the menopause brain has become an important topic of conversation every day in my office. So a couple of things I'm going to tell y'all today is, one, how women's brains are different than men's brains. And number two, the effects of menopause on our brains. And then also, well, what can we do about it? So for most of medical history, we thought that male and female brains aged the same way. But over the past decade, and literally it's just been the past decade, neuroscience has revealed something remarkable. The female brain goes through major biological changes in midlife. It's not just our ovaries. That transition is menopause. And so today what I'm going to talk about is what happens to the brain during this time with the loss of estrogen, and why midlife represents one of the most powerful opportunities that we have to protect our long-term brain health. This is Mary. She is a very common patient that comes into my office, very concerned. She's 50 years old, going through menopause. And she tells me all of a sudden in the last few years, she's noticed that she can't remember words. She walks into her room. She forgets why she's there. Her sleep is terrible. She's had trouble focusing, staying on task. She's mentally foggy. How many of y'all felt that way during menopause? Yeah. Very common. But what she's most afraid of is that she thinks that this is the onset of dementia. And what she's actually experiencing is what we've all gone through or are going through, is she's entering the midlife transition and she's feeling the effects of the loss of estrogen on the brain. So we're going to talk about that today. So why does this matter? She's read the news and she hears that 2/3 of all Alzheimer's patients are women. And today, there's more than 6 million Americans that are living with Alzheimer's disease, and that number is expected to double, as you've heard in previous talks, by 2050. So we have to ask the important question, why are women disproportionately affected? Part of the answer may lie in the neurological transition that occurs during menopause. So why do women develop Alzheimer's disease more frequently than men? Well, there's several overlapping factors. The honest answer is we don't have the answer, but these are some of the theories. First is menopause is due to a decline in estrogen, which actually changes our brain's energy, metabolism, and connections. Second, in the midlife, as we just heard, the vascular talks, in midlife, there's a lot of metabolic changes that are going on that are making us more prone to insulin resistance and vascular inflammation, which makes the vascular component of dementia also a part of this. Third, we know gene factors, and there's many of them, but particularly ApoE4 appear to have stronger effects in women. And is this due to the lack of estrogen that happens around menopause? Research is leaning that may be, yes, that might be a contributory factor. And finally, lifespan. While we know that women live 5 to 6 years longer than men, and age is indeed a risk factor for dementia, even if we adjust for age, women are still having a higher prevalence of Alzheimer's than men, so age just doesn't explain it alone. There's biology behind it. It was thought that menopause initially was just all about reproductive decline. Our ovaries weren't working anymore. They're shut down. And the loss of fertility. We're not having babies anymore. But modern brain imaging, as we've seen in previous pictures, tells us something different. Menopause is a neurological transition also. And during this time, our brain undergoes measurable changes in structure, connectivity. Our connections are wonky, the pathways are not quite right, as well as metabolism in our brain. And it's the loss of this estrogen in perimenopause and menopause that leads to what we're going to call midlife mental fatigue, which is brain fog. So this helps to explain why 80% of women do report brain fog, neurological changes that happen during menopause. Brain fog, sleep disruptions, night disturbances, mood changes, and memory complaints are all very common symptoms. As you ladies just raised your hand, that we have all gone through this. But these are not simply hormonal inconveniences. They are our brain adapting to the lack of estrogen and a changing hormonal environment. The brain represents only about 2% of our body weight, yet it consumes 20% of our body's energy. It is metabolically active. And estrogen helps the brain efficiently produce that energy by supporting mitochondrial function. We've heard a little bit about ATP, and glucose metabolism. When estrogen declines during menopause, the brain temporarily shifts into a lower energy state. It's functioning differently. And that state explains the symptoms that many of us experience, the brain fog and the mental fatigue, the trouble finding words and difficulty concentrating. And the tasks that used to seem easy to us all of a sudden seem hard. But the good news is that most of our female brains adapt beautifully over time. It might take 2 to 6 years after the last menstrual period. These symptoms don't go away in a year, they linger for a while. But most of us, our brain is adaptable and it finds new connections. But for some women, that metabolic shift makes our brains more vulnerable to dementia later in life. Estrogen receptors are everywhere in our entire body, from head to toe. But in our brains, they're the most prominent in the primitive portions of our brain. In the hippocampus and the medial temporal lobe, that's our memory centers for the brain. In our amygdala, that controls our emotions. It controls our fear. It controls our empathy. In the frontal cortex, it helps us with critical reasoning and thinking and inhibition. And in our posterior parietal cortex, that helps us form memories of where we've been and what we've seen. In our brainstem, that controls autonomic functions such as heart rate. And our hypothalamus is where our hormones, some of our hormones are made, and it's actually our thermostat in our brain. So it's no wonder, ladies, why when we hit midlife, all of a sudden we feel like we have ADHD because we can't remember names, we're way more emotional, sometimes fearful, sometimes full of rage. Sometimes we want to join, the latest thing I've heard is the I don't care club when you hit 50. And we can't remember where we were yesterday or where we put our keys, and we start having heart palpitations, which has to do with the brainstem, and then we also are having hot flashes, which has to do with our thermostat. All of these places in our brain are rich in estrogen receptors, and it certainly gives us an explanation of why we've been feeling the way we've been feeling. And men, we just have to thank you for putting up with us through those years. So, during perimenopause, we do see the measurable reductions in brain metabolism. We see a decrease in size in the hippocampus and the gray matter. And I just want to talk about a couple of researchers that are in this field. I've been to the Menopause Society meeting the last 2 years, and there's so much research that's actually being done now on the menopause brain. Lisa Mosconi, she has a PhD in neuroscience, and her grandmother had Alzheimer's, and she's dedicated her life's work on dementia. And she has some fascinating research on the impact of the absence of estrogen and the changes that occurred in the brain. And if you want to read a really good book, it's called The Menopause Brain that she wrote, and it's really fascinating. And what she says is that the absence of estrogen leads to changes in brain metabolism and the uptake of glucose, which the brain needs as fuel. And this can lead to several things, such as demyelination. And it's the cleanup of this demyelation of our neurons that can lead to neuroinflammation. And this can actually increase the temperature of our brain, which is maybe why we're having some of our vasomotor symptoms. But it also puts women at risk when the inflammation goes up in the brain and the temperature goes up. It puts us more at risk for Alzheimer's disease and dementia. Advanced imaging studies using PET scans and MRIs allowed researchers to observe these changes directly. And there are two other researchers that I often see at the Menopause Society. One is Rebecca Thurston and Pauline Mackey, and they're doing research on changes in menopause by doing brain scans on women who are going through the transition. And what they found is that women who have more hot flashes, and particularly night sweats and trouble sleeping, they have more of white matter hyperdensities and are more at risk for vascular dementia. So we just heard from the previous lecture that white matter hyperintensities do put it more at risk for not only dementia, but also cardiovascular disease. So this research is just beginning, and hopefully we'll have some more answers in the future. The encouraging news for all of us is that the brain is remarkably resilient. The brain is transitioning in perimenopause and menopause to work without estrogen. And so the chaos that's happening, it's like a female brain renovation project that's lasting for 2 to 6 years. But once we get done with the renovation project and develop new connections, we tend to adapt, we've adapted to the lack of estrogen. But some women don't compensate equally as well. So who is most vulnerable? Women who enter early menopause. If you went through menopause before the age of 45, you're more vulnerable to having these changes and more vulnerable to dementia. If you had surgical menopause, where you had your ovaries removed when they were still functioning, this can also put you at risk because it's an abrupt change. All of a sudden you had estrogen, the next day you didn't. And you also see this kind of helps to explain why after deliveries, and women who are pregnant, their estrogen levels are very high, and after they deliver, their estrogen drops tremendously. And those women also have brain fog and some of the same similar symptoms that perimenopausal women are having. Severe sleep disruption is also increases our vulnerability, excessive night sweats, metabolic disease, and genetic risk. So my personal theory, and this is, there's no science behind this, but there is science behind it. But my personal theory of partially why women may have more Alzheimer's than men is, gentlemen, if your wife is menopausal and she's not on estrogen, the shocking factor is you have more estrogen than she does. So your testosterone, you are still making testosterone. You're lucky that typically never stops. But we have an abrupt halt in our estrogen levels. So men, for years, continue to make testosterone. 50% of it gets converted to something called dihydrotestosterone, and 50% of it gets converted to estrogen. So men, your estrogen levels are higher than many of your wives. And this could explain why women are more at risk. So hormone therapy has been one of the most controversial topics in menopause care, and the pendulum just keeps swinging, right? Early headlines back in 2002 and back in the early 2000s suggested that hormones increase the risk of dementia. But there was an important detail. The increased risk of dementia was in women who started hormone therapy after the age of 65. And it was in the hormone formulation from years ago called Prempro that we don't use anymore. And there wasn't a comparison with what we currently use, estradiol and micronized progesterone. Experts now suggest that there's something called a critical hypothesis window. Starting hormone therapy near the time of menopause may support brain health. Starting hormone therapy decades later may not provide the same benefit. And is this because when you're over 65, you may have more vascular disease? Or is maybe it because the brain rewired during that change of life and there's a down regulation of estrogen receptors? So if we give this 65, 70-year-old brain estrogen, it may not respond the same way. We don't know, and these studies are still ongoing. A recent study has come out that says, as you know, the ApoE4 gene can influence Alzheimer's risk. ApoE4 carriers show more pronounced beta amyloid deposition and tau pathology, as we've seen earlier today. And a recent study that was published found that menopausal hormone therapy in women who carry this gene may decrease their risk of dementia by improving amyloid clearance. Now, this finding is exciting, but certainly more studies are needed in the area. I'm happy that these studies are coming out because we do need to dig in more. And it's also important to emphasize that hormone therapy has not been proven to prevent Alzheimer's disease in a randomized controlled trial. And a randomized controlled trial is what scientists use to prove cause and effect. So there has not been a randomized controlled trial that says that hormone therapy helps. However, many observational studies, which are not as good, it's harder to prove cause and effect, do suggest that hormone therapy may have beneficial effect when started near menopause. What dose of menopausal therapy, what formulation of menopausal therapy, it's unclear because it's a data-free zone. We don't have research in that area. But hopefully now there's more emerging studies, and now that we have brain scans and biomarkers and we don't have to wait 10 or 20 years when you do something at 50, well, where will it be at 70? Because we have these brain scans and biomarkers, more research is more rapidly emerging, and maybe we'll have some answers in the next 10 years. So our take home for now is that hormone therapy is very effective at treating symptoms such as hot flashes, sleep disruptions, mood swings. And improving these symptoms can indirectly improve cognitive function and quality of life. And it's important to recognize that hormones are not a magic bullet, but it's a tool, it's one tool in our toolkit for midlife strategy. Not every woman can take hormones. Individualized care is essential. One size does not fit all. And menopause care is increasingly moving towards individualized precision medicine for each patient. So since hormones are only one piece of the story, let's talk about what other actionable things we can do to improve our brain health. As you have seen all day, lifestyle matters, and I cannot stress that enough. These are our tools in our toolkit. Sleep, physical activity, nutrition, stress, resilience, social connection. You've heard that through all the lectures today. And up to 40% of dementia cases may be preventable through lifestyle intervention. And this is encouraging because this gives us the tools that we need to shape our future. You know, we have some semblance of control in something that may seem out of our control. Many of these interventions are most powerful when they're implemented in midlife, but it's never too late to start making these changes at any age. Lifestyle is a long-term investment with a slow time period, but yet a big return. So my strategy for my patients is I focus, and you've heard this all today, and we've all had our different ways of saying this, but I was kind of happy that everyone has touched on this because it just reinforces that we're all on the same page. These are my strategies for the 8 pillars of health. When patients come into the office, I talk about these things. And these are some of the most powerful tools you can have to improve not only your brain health, but your overall health. We've talked about hormones, so we're not going to dwell on that. We're going to talk about the other things that you can also do, which is metabolic health. We can't control our genes, but we can control how we live. And especially with cardiovascular health and metabolic health, just like the last lecture, it's so important to know your numbers, right? You need to know your blood pressure. You need to be paying attention to your blood pressure. You need to know your lipid levels. You need to know your hemoglobin A1C. And something that's not talked about, but I check in my patients, is a fasting insulin. You know, if you have kids out there, that certainly is the window to start looking at fasting insulin, because every morning when you wake up, as an example, and you have not eaten and you're in a fasting state, your insulin should be low. Your insulin rises after you eat a meal and you eat something that has sugar or carbohydrates. So in the morning when you wake up, you should have a low insulin level. If you're waking up and your insulin level is high, that is telling me that you may have some insulin resistance and your insulin is running a little higher than it should be in the morning state. So it's a good marker. So ask your doctor about that. Fasting insulin, it should be less than 10. And if it's above that, then you probably have some semblance of insulin resistance. That 5 or 10 years down the road, you'll see changes in your hemoglobin A1C. Movement, we've talked about. Not only does exercise increase blood flow to the brain, as you've already heard, but one fascinating fact is that when muscles contract, they release a peptide, which crosses the blood-brain barrier, and it protects the brain by reducing oxidative stress and inflammation in the brain. And one simple take-home thing that you can do besides walking and moving your body, there was a recent researcher that was very much into resistance training, and one of the things that she said is if you just do 2 days a week of 6 to 8 exercises, you know, whether it's just small weights, doing something, you know, moving your arms up and down. If you do 6 to 8 of those 6 to 8 times, or should I say 3 reps 6 to 8 times, then they have proven that decreases that increases hippocampal growth and increases connectivity in the brain and cognitive velocity. So this is our motivation. That there have been actually studies that they're looking at these brain scans, and they're showing that the brain is growing, the hippocampus is growing, the connections are now faster. So if we just motivate ourselves to do 2 times a week, that can help grow our brains. We've talked about food. Food is the biochemistry for the brain. And the brain loves, and the brain loves an anti-inflammatory diet, particularly, as we talked about today, the MIND diet. So the take-home 2 tips I was going to leave you for that, we've already touched on, is olive oil. It was already mentioned earlier. And 7 servings of vegetables. And a serving is about the size of your fist. And if you ate that lunch today, especially the vegetarian one, you probably got a good 3 or maybe even 4 servings of vegetables in your day. So it's not impossible to do 7. And these lifestyle changes truly matter. We've talked about sleep. That's the time for our bodies to repair itself. We won't talk about that. We talked about stress and resilience, how stress plays a role on increasing our cortisol, and that plays a role on our brain. Social connection. We've already hit on that today, so I'm not going to repeat that, but social connection is critically important. You know, one of the things I noticed with all the blue zones is their diets were all different, somewhat, right? They ate different things. They were all healthy, they were all plant-based, but they all had social connection. That was the one binding thing that they had. And then the environment. You know, really looking at environmental toxins, pesticides, plastics, doing small things that we can to decrease areas of inflammation. Mold, you know, we live in New Orleans, so it's hard to get rid of that one sometimes. So getting back to Mary, who I saw in the office, right? I heard this quote, and actually I believe Lisa Mosconi, who wrote the Menopause Brain book, says this. You know, when should she worry? What's the difference between brain fog and dementia, right? So brain fog is when you can't remember where your keys are, right? I do that all the time. I can't remember where something is. The red flag, especially for patients to go in and get tested, is when you can't remember what your keys are for. So I thought that was just so profound. For generations, women were told that menopause was the beginning of a decline. But I'm going to tell you something different. Menopause represents a biological turning point, a moment for us to stop and reevaluate and reset our health trajectory, because small, consistent changes matter. It's a neurological transition. Estrogen plays an important role in brain function. The timing of hormone therapy matters. And lifestyle interventions in midlife is one of the most powerful tools we have to protect long-term brain health. We have an opportunity. We all want vitality. The end goal is not simply adding more years to our lives. Our goal is to add more life in our years. These are my references, and thank you all very much.